Hi, my name is Dr. Paul Choi. I am the director of Los Angeles Endoscopy Center. I am also a fellow member of American Gastro-Enterological Association. In this presentation, I'll be discussing Gastro-Esophageal Reflux Disease, commonly known as GERD. GERD is a very common disorder. It is estimated that up to 20% of adult population experience symptoms of reflux disease at least twice each week. Dietary pattern and obesity are the most important causes of GERD. In fact, the rising incidence of GERD in the general population is likely to be due to the overall increase in calorie consumption and resulting obesity. Often, patients with GERD complain of heartburn, a burning sensation in the chest. This pain may radiate to the neck or throat. In addition, some complain of indigestion, acid regurgitation, sore throat, cough, and even asthma. When we eat, the food passes from the mouth into the esophagus down to the stomach. This food is prevented from backing up into the esophagus by the sphincter at the end of the esophagus called the lower esophageal sphincter. However, when this sphincter does not function properly, the food content as well as acid and digestive enzyme in the stomach may back up and reflux into the esophagus. When this occurs, it can cause inflammation of the esophagus and symptoms of GERD. To make the diagnosis of GERD, the medical history needs to be carefully reviewed. In GERD, the development of symptoms is often closely related to the size, time, as well as the type of meal. However, when symptoms do not respond to medical therapy, an evaluation with an upper endoscopy should be undertaken to establish the diagnosis and to rule out other disorders such as an ulcer or even cancer that can produce symptoms that are similar to that of GERD. In addition, a pre-malignant condition related to GERD, known as Barrett's esophagus, may need to be ruled out with endoscopy as well. The treatment of GERD consists of medical as well as dietary and lifestyle modification. In the dietary control of GERD, it is important to reduce the size of meal that will reduce the chance of food refluxing into the esophagus. It is especially important to avoid a large, late dinner. In fact, all foods should be consumed at least 3 to 4 hours before going to bed. Elevating the head of bed and sleeping on the left side can be helpful. Avoidance of food that often aggravate GERD, including tomato, peppermint, onion, chocolate, coffee, and greasy food should be undertaken. Smoking and alcohol should also be avoided. Maintenance of proper body weight and regular exercise are often helpful. For medical therapy, taking over-the-counter medications that neutralizes the acid in the stomach, such as Tums or Gaviscon, may be tried as an initial step. If necessary, a trial of medications that suppresses the production of acid in the stomach, such as Zantac or Prilosec, is often adequate for most patients in relieving the symptoms of GERD. In more difficult cases, a surgical treatment called fundoplication may be considered. In summary, GERD is a very common disorder that arises from the refluxing of stomach content into the esophagus. Most cases of GERD can be treated with lifestyle and dietary modification along with medical therapy. However, in more difficult cases, such as non-responders, a complete and thorough evaluation, including an upper endoscopy examination, is recommended. Thank you for listening.